Hello, my name is Dr. Salem. I'm a doctor of physical therapy from Brooklyn, New York. Today, I want to have a live case from my clinic, but today I want to speak about how the role of the vessels, the viscera, anything with the lumen affects your joints and your spine pain. How am I going to explain this? Okay, let's assume that any vessel that runs in your body, let's say superior vena cava, inferior vena cava, the aorta, I'm just giving you examples, the ureter, the small intestine, when they are flexible, they have smooth muscles in the wall. And the weakest point in a vessel is the intima, which is the most inner layer. Imagine a vessel like the aorta or the superior vena cava, inferior vena cava. When the intima get injured, it's going to make it like a crack inside. The intima has a crack inside. And the fluid goes with the flow going there, so the intima make a flap like this and block or obstruct the vessel. This could be a medical emergency. The lumen of the vessel or the viscera or whatever, it has so many receptors that connect directly to the brain, cerebral cortex, and the spinal cord. And any dysfunction, any hardness that affect the vessel or the viscera that we spoke about, the spine has to stiffen. All the muscles surrounding the spine has to spasm, contract to prevent any fracture or any injury, any crack in the intima and the lumen, because it's called a medical emergency. Okay, when you have, let's assume now we have a vessel like the aorta, the inferior vena cava, superior vena cava, your ureter, the vas deferens, name it, your small intestine, the large intestine, and the smooth muscles. I want you to pay attention, that's good for you. The small muscles in the wall, the small muscles in the wall are relaxed and comfortable. So when you bend down, it's going to flex with you. Imagine this is a vessel. Imagine this is one of the big vessels, like major artery, major vein, major vessel. When you bend down, this has to bend with you. You straighten up, this has to come with you. When you twist, it twists with you. Okay, imagine now they have a severe spasm in the smooth muscles of the wall of the viscera, like the small intestine, large intestine, okay, like esophagus, like the ureter, like the vas deferens, like inferior vena cava, aorta, as we said. And this small spasm can become, instead of being flexible like this, movable, going to be like hardened like this, semi-hard. This one is semi-hard, going to be like that. Okay, when you try to twist, going to be hard to bend, hard to extend, hard to twist, hard to side bend. You get this? It's a little hard. And if you hardest for the vessel, okay, we spoke about the weakest point of the intima. The intima may crack. And if you crack with the flow, it can make a flap, and the flap can make obstruction. Okay, that's why it's emergency. Sometimes too hard as like this, you cannot bend at all. So we give you stiffness. Now I'm gonna take every day. I'm gonna give you a group of cases. Now I have my sister here. She permitted me to film, but no face. Okay, she complained about back pain. Okay, this main complaint. Stiffness, and she has back pain on the glutes and pain everywhere, but she also complained of a pain around the belly button. She told me to feel that her belly button, the umbilicus, is being pulled or cramps and have been all over the head. Okay, now I'm going to show you today the small intestine, how the small intestine can affect if it has hypertonicity in the smooth muscles of the wall of the small intestine, going to be stiffened and going to give you back pain, and can give you limited lumbar extension. It can give you limited hip extension. And after you relax the smooth muscles of the wall of the small intestine, the range for the lumbar spine extension will be better. The back pain might get better. The hip extension might get better. This can give you the technique I'm going to show you now and how to examine first. First, everything before we do, we need to examine. This is based on Dr. Jayamiti's work, an advanced counter-strain technique. We spoke about Dr. Lawrence Jones, who found the counter-strain technique. Dr. Lawrence Jones found 175 points in the body. He did 50 years of research. If this point is tender, what could be spasmed and what technique to relax it? Dr. Jayamiti did another 35 years of research on advanced counterstrain. She found that not only the skeletal muscles, she found also the vessels, the viscera, and the fascia, and the skin has tone as well, and we need to relax those as well. Let's know now about how to diagnose based on Dr. J. Matteo for a small intestine spasm. It could be the cause of a back pain and stiffness and hip pain. Let's go. This is the umbilicus. I'm going to go 1 inch below the umbilicus in the midline. Then I'm going to go 2 inches 45 degree out of that point. First, you're going to go 1 inch down. Okay, you get 1 inch down is here. Then you're going to go from here 2 inches out, diagonal 45 degrees in this point. If it's just tender, is it hurting, mommy? Speak, don't worry.
Yes.
It hurts, okay. I can go on the other side and find out. Is this one hurts too?
Yes.
Okay, there's more, yeah?
Yes.
Okay, this the left side is more. I'm going to try treating this first, okay? Could be the small intestine. How we're going to treat? Okay, we're going to be do scissoring of the legs, okay? I'm going to treat the left side, the small intestine first because it's the one more tender. Don't worry. You can take it out, Okay, now I'm going to take this leg, head flexion 60 degrees. Okay, relax, mommy. Now, this is a counter strain. It's an advanced counter strain technique. All should be passive, 100% passive. Patient should be relaxed. The results works 100% if the patient can relax and you do passive technique. Flexion hip 60 degrees is good. Keep your knee straight but not locked. Adduct both sides, scissoring. I'm going to adduct the lower leg on the table like this. Keep just scissoring both legs. What I do myself, if I want to help, I can do this to help. This is good enough for me, but I can do this to help. I'm going to push this leg like that. I'm going to do this here. I'm going to keep this. And now I'm going to check. This is a belly button. I go 1 inch lower. Then from this point, I'm going to go 2 inches diagonal and check. Mommy, dard the Torah come? Come?
Yes.
Come. Now the pain is less. Dard in Urdu means pain. Come means is gone. When I do this technique here, okay? Now the pain is much less.
You can speak English.
Yeah, the pain is much less. The pain is much less here now, my brother. This is for the small intestine counter strain. Okay, based on Dr. Jamitia work, you need to keep this between 1 minute and 5 minutes. It depends on, okay, how chronic the pain is, for how long she has this pain, the patient has this pain, how severe it is, okay? There's a first time, it's better to keep it up to 5 minutes if you can, if the patient can take it. If you cannot, you can stop anyway between 1 minute and 5 minutes, and you can repeat it as many as needed. Okay, this give you a relief for sure. If the cause is just a muscle spasm and cramps and just the sympathetic hyperactivity causes spasm in the walls as well of the smooth muscles. If this overactivity with the sympathetic, with life stresses, with financial stresses, with psychosocial and economic status, whatever, emotional, when there's sympathetic hyperactivity, the smooth muscles of the viscera and vessels will be like, increase the tone. And if this only the cause, the effect will be lasting for a long time. But if the cause is an infection in the small intestine, this can give relief for several hours. After that, going to come back again, unless you treat the infection with the doctor, for the treat infection. But if the infection is the cause for the spasm, going to give relief for several hours. Then you come back again until the infection is treated. But if the cause is just simply as sympathetic hyperactivity, okay, and parasympathetic hypoactivity, this will help. This is based on autonomic nervous system. This will stimulate the parasympathetic activity and make more relaxed, and will inhibit the sympathetic activity. As long as we keep with me, guys, I'm going to teach you how to add more techniques while I'm doing this same technique. This technique now is a preliminary for the people who just started, but we can add some other techniques that will help make this technique more efficient by inhibiting the sympathetic overactivity and enhancing the parasympathetic activity to get wonderful, long-lasting results. That's why I keep telling my young doctors who's watching me now, this mainly for young doctors, please guys, keep learning, never stop learning, keep learning from your ancestors, learn from the elders, okay? And if you need RCT, randomized control trial, Go do your RCTs, go do your research, and let me know. If you try it in your patients, read the comments underneath. I want you to try it in your patients, doctors, please, and let me know how it's working, okay? This is Dr. Salem from Brooklyn, New York. Stay tuned. We're going to give you live cases from my clinic. Coming soon will be the ureter. How to diagnose the ureter as a cause for a back pain and stiffness. If the smooth muscles of the ureter are in spasm, of course, unilateral, bilateral. How to find out if the large intestine is the cause, how to find out if the vas difference, if it's the ureter, so the uterus, if it's the vagina, if it's the prostate, if it, I'm going to give you all this based on advanced counter-strain technique of Dr. Jamie Teal. This is Dr. Salem, Brooklyn, New York. Please subscribe to my channel so you can get the best of education, of learning experience, live cases from my clinic, and share it with your friends, and press like if you like it. Bye now.